We are thrilled today to have Dr. J.J. Cutuli from Nemours, our speaker, to talk about issues of homelessness in high school. But before I introduce him, let me mention some housekeeping issues. So we will continue extending CME credits for our tech talks and our ID series presentations. We will distribute the information via email to those that registered for today's event. But if you did not register prior to today's talk, you can still obtain CME code information from Deborah Rees, and her email address will be posted in the chat box today. So our upcoming events, our next tech talk will be on January 6th, and that will be Dr. Rich Brown from University of Delaware, who will talk about mathematical modeling and data science methods in dynamics of the tear film on the eye surface. And then we will have an ID series on January 13th from Dr. Craig Pollack from Johns Hopkins, who will talk about housing policy, neighborhood context, and health. So you do not want to miss these presentations. So again, I'm really very happy to introduce Dr. Cutuli today. Dr. Cutuli has been a senior research scientist at Nemours Children's Health since 2019. And prior to 2019, he was assistant professor in the Department of Psychology at Rutgers University in Camden. He obtained a PhD from University of Minnesota in developmental psychopathology and clinical science. He has had multiple awards, the last one being Chancellor's Award for Civic Engagement from Rutgers University. He also has had several grants from the Institute for Education Science, a federal agency, as well as from foundations such as the William Penn Foundation, the Bill and Melinda Gates Foundation, and multiple other sources. He has a long list of publications and has been invited to give talks all over the country, so we are extremely lucky to have him today to talk about this very important topic. So thank you again, and welcome, and we look forward to your presentation.
Great, thank you so much. I'm flattered by that introduction. That might be the best introduction I've ever had. I hope I can live up to it. Yeah, thank you for having me. It's a real honor to be able to present, and I really appreciate the opportunity. Today we're going to be talking about homelessness in high school. And so I primarily study resilience and development, but part and parcel with studying resilience, which is the study of children and families who do well despite experiencing adversity. The other side of that coin is understanding how adversity works and how risk works in the lives of children and today in the lives of adolescents. So homelessness is a risk factor that we'll get into today. This work, I want to make sure I mention, is the product of a team of myself and co-authors, and it's largely the work of Danielle Hachimonji, who was scheduled to co-present today. However, she very much regrets not being able to be here. There was a quarantine in her children's classroom at the Nemours Child Care. And she's in the quarantine period, and she wanted to try to time her young children's naps so that she could be here. But I told her, that's something that no parent can control. So she sends her regrets, and she looks forward to being able to present again in the future. This was largely Danielle's work when she was a postdoc at the Center for Healthcare Delivery Science with me at Nemours, and she is now on faculty with us. So we're very fortunate to be able to keep her. And I will also say that the data I present today all originates and is commissioned by the Centers for Disease Control and Prevention. However, the analyses and the interpretation and everything else is my own, and it does not necessarily reflect their point of view. They do not necessarily endorse what I say. So a quick overview. I'm going to begin by providing some background and context about high school homelessness and why the report and the findings that we're presenting today is important for moving us forward and supporting high school students experiencing homelessness and promoting more resilience. I'm going to then provide an overview of the findings, and then I'll present some recommendations for policy and practice in light of these findings. And this presentation and this work really has a policy focus, and it is something that we very much value, is speaking to broad audiences, not only of researchers and practitioners, but also policymakers. And a lot of what I have today is especially relevant in multiple fields, including education. Now, when I refer to homelessness, I'm referring to an experience that some teenagers have where they lack a fixed, regular, and adequate place to sleep at night. Some adolescents experience homelessness by sleeping in a public place, like in a car or on the street. Others stay in shelters or substandard housing. But most teens who experience homelessness, by far most, stay doubled up with friends or another family because they lack access to regular housing. Usually it's an affordable housing problem, but some teens experience homelessness with their family, whereas others are unaccompanied and they're on their own. And lots of different situations and scenarios contribute to homelessness, but I always find it's useful to set definition, and we'll talk a little bit more about definition in a second as it's relevant to today. Now, like any social policy concern, adolescent homelessness is not evenly distributed across the population. It tends to cluster within a few groups, and in policy circles, there's an increasing focus on identifying and eliminating these disparities between groups. Black and Latinx youth who identify as lesbian, gay, bisexual, transgender, and certainly low-income and very low-income youth are all very much more likely to experience homelessness than teens in other groups. Now, this happens because of multiple contributing factors. Black and Latinx youth face long-standing systemic racism in the form of discriminatory housing practices, disproportionately high rates of poverty, and further strains on social and financial resources like high rates of paternal incarceration, poor access to health care, a whole litany of things can contribute to situations that result in homelessness. Now, for LGBT youth, their homelessness is often rooted in discriminatory experiences, bias, peer victimization, and importantly, family conflict and family rejection. Now, the causes of homelessness are not limited to race, ethnicity, gender, sexual orientation, but those are just among some of the things that we're able to focus on in the study I'm going to tell you about today. We also know that homelessness is associated with a host of risky behaviors and poor outcomes. And some of the more prominent ones are listed here. They include being the victim of violence, poor mental health, severe suicidality, alcohol and drug use and misuse, risky sexual behavior, poor school attendance, poor academic achievement. Now, some of these things are consequences of homelessness, and others are caused by the same chronic disadvantages like poverty and race-related systemic inequities. Things that drive homelessness itself can also drive these negative experiences and outcomes. So one of the things we're going to talk about today is just trying to get a reliable handle on how many students are homeless. We got to start at prevalence and scope before we can really effectively develop policy and practice to meet the need. And when we're talking about counts and prevalence estimates and just how many students are homeless, things start to get murky real quick. And one thing I want to make sure I acknowledge today is that there are different federal agencies that are primarily, or maybe not primarily, but who are focused on homelessness. They have mandates to identify and serve students who experience homelessness. And these multiple agencies have multiple definitions and multiple ways of counting homelessness. And that really causes some confusion. In the Department of Education, there is McKinney-Vento legislation that defines homelessness as any student if they lack a fixed, regular, and adequate nighttime residence. And departments of education are required, state by state and district by district, are required to identify homeless students and provide them with a breadth of services in order to ensure that every child has access to a free and adequate education. So homelessness shouldn't get in the way of education. And the U.S. Department of Education estimates that about 1.3 million students in America were identified as homeless during the 18-19 school year, which is relevant today. So 1.3 million students is already a fairly sizable number of students, but we'll talk about whether or not that's a valid number. Now, at the same time, the U.S. Department of Housing and Urban Development creates estimates of homelessness, mostly from a point-in-time count that estimates the number of people literally homeless, meaning they're literally sleeping on the streets or in a shelter or transitional housing program. And they base this count on a single night in January. So on a single night in January, they count everyone who's in a shelter, and they try to find everyone who's on a street, and they use that to match their definition of literal homelessness and provide an estimate of its prevalence. And from that, because it's a more restricted definition and different methodology and a single point in time, they estimate about 172,000 children from birth to 17 experience homelessness, and about 35,000 unaccompanied youth, which are defined under the age of 25, were homeless at that point in time. Now, both of these estimates are likely to be gross underestimates. It's kind of an open secret in the field of homelessness, and especially the numbers produced by HUD are likely to be wildly undercounting the true prevalence of homelessness. So that begs the question, who are we missing? Now, there are notable methodological constraints in both how the Department of Education does it and how HUD does it. And these limitations are particularly poignant and impactful for homeless adolescents. Homeless adolescents, even more than other groups, are more likely to resist being found or even to identify themselves as homeless should they meet the definition. They're also more likely to refuse services, making utilization-based counts, like what HUD does, counting the kids in shelter, really challenging because these kids, they resist going to shelter. So what I'm presenting on today is a growing line of work looking for a better data source to estimate homelessness and try to identify risk and associated needs so that we can help serve these children once we peg the scope and are better able to identify them. And this is in the Youth Risk Behavior Surveillance System, or more commonly referred to as the Youth Risk Behavior Survey, or the YRBS. Now, the YRBS, it's an anonymous survey. They do it every 2 years in different places across the country. Most states have one. It produces information about all public high school students in individual school districts, again, in just about every state. There's 4 states that don't do it, but it produces data in all the other ones. And it uses a complex sampling design to take its sample and ensure that it's represented, the findings are representative of all students in high school in those states. And they also do it for some school districts, which we'll talk about in a second. And I really can't overstate how important this is because there's no alternative to gathering statistically viable data about that many students across a broad range of policy and practice relevant domains. They use the public health sampling frame of the YRBS, which is what it does. They use it well. And luckily for us, more and more communities are starting to add questions to the YRBS that they're doing anyway, but the questions that they're adding are having to do with housing status of teens. So during the 2015 YRBS, only 8 states really gathered representative housing data. And in 2019, 25 states plus the District of Columbia asked about housing status, which will allow us to estimate student homelessness. There were two housing status questions they could ask. One asked students about where they usually slept in the past 30 days, from which we can discern homelessness. I'll talk more about that in a second. And the second asked about whether the teen slept away from their parents or guardians because they were kicked out, because they ran away, or because they considered themselves abandoned, which maps onto unaccompanied forms of homelessness. And in addition, the YRBS also asks about factors that could contribute to homelessness, along with risky behaviors that could co-occur with or maybe be caused by homelessness experiences. So with all this data, our group set out to do the following. First, we wanted to produce a better estimate of the prevalence or scope of adolescent homelessness. Second, we wanted to better understand who these teens were. Third, we went on to examine and test relations between youth homelessness and a range of negative outcomes, including alcohol and drug use, risky sexual behavior, and severe suicidal thoughts and behaviors, and poor grades. And finally, we wanted to leverage findings to recommend strategies for identifying and supporting high school students experiencing homelessness. So, first I'm going to tell you where the data came from. Now, we were limited to YRBS efforts in states that chose to ask the question. In 2021, all states, it's going to be on the standard form, so all states in a national effort are going to ask about homelessness. But in 2019, when these data were collected, only 24 states that we had access to asked at least one of the two questions about homelessness. And they also had to collect good data so that we could use the complex sampling design. And really, deploy best practice in that way. I will say, thinking about the audience today, Delaware didn't meet that standard in 2019. So Delaware's been a leader in looking at homelessness on the YRBS for many years, but in 2019, their YRBS didn't get enough responses to be considered, methodologically viable. And so they're not included in today, but we did include South Carolina, and I'll talk about school districts. There's a school district in South Carolina that's specifically included in today. And again, I have to highlight the importance of the sampling frame, the complex sampling methodology that allows the data from each state to be representative of the whole state. And so, based on 36,000 observed surveys, we can draw conclusions about almost 6 million high school students across all the public high schools in these 24 states. Almost 6 million. Now, we were also able to include 12 school districts. So there's a statewide YRBS in a bunch of states, and then there are a handful of individual school districts that look just within their district, and they do a YRBS to get rates there. And 12 states asked homelessness questions that we'll look at, and they're highlighted here. And there are over 26,000 observed surveys can be extrapolated up to over 500,000 high school students in places like Seattle, Albuquerque, New Mexico, Chicago, Gaston County, Palm Beach County, Philadelphia, New York City, Boston, places like that. Now, as a reminder, we use the definition of homelessness per the Education McKinney-Vento legislation with two questions. Now, the first asks about, on the left here, where the student usually sleeps at night. And the second question gets at unaccompanied homelessness by asking about running away or being kicked out or abandoned. And here are the responses for the first question. The red boxes, I hope they're coming through. They're not quite as bright on my screen today. But I hope they're coming through as red. They're the ones in the middle, not the top or the bottom one, but the ones in between. The first question asked about where the student usually sleeps, and the ones in red count as homelessness. doubled up in a shelter, in a motel, hotel, car park, or just not having a usual place to sleep. And we didn't count in a parent or guardian's home. Most students sleep in a parent or guardian's home. And we also didn't count somewhere else, because when a student said somewhere else, very few did, but when a student said somewhere else, we just didn't know what it meant. So we wanted to be conservative there. So we did not count somewhere else as homeless. Okay. And then in the second question, if you said it was a yes, no, if you slept away from your parents in the past 30 days because you were kicked out, run away, or abandoned, we considered that a homelessness experience. Okay, so our first takeaway is that way more high schoolers, if you ask them, reported homelessness than were identified by their schools and the education agencies. And I should say that the YRBS is administered in the schools. So, if a student isn't in school and homelessness is associated with dropping out and absence, then they wouldn't be counted here. And that would probably reduce our estimates. And so the YRBS is a survey done in the school, at school. Okay. So, out of the almost 6 million public high school students across the 24 states, the estimate was over 500,000 students in the states experienced at least one type of homelessness in the past 30 days. So right now I'm just telling you about the states together, and later I'm going to tell you the same estimates and findings when you look at just the individual school districts together. I hope that makes sense, because some of the districts are embedded within states, so it doesn't make sense to lump the districts and the states together. So we're just going to do states right now. Over 500,000 students across 24 states. That's over 9% of public high schoolers in these states. Okay, and by comparison, if you look at the official counts from the Department of Education for high school students in these states in the 2018-19 school year, so they do homelessness at any point over a 12-month span compared to the YRBS 30-day estimates. The Department of Education only found about 170,000 high school students that whole year. Something north of 300,000 students who experienced homelessness at least weren't identified and weren't served and weren't given rights that they're entitled to by law in schools based on their homeless status. So what we're doing is we're quantifying how much of an underestimate this likely is in the official numbers of homelessness the Department of Education generates. Now let's look at the 12 individual school districts, the Chicagos, Philadelphia's, Boston, kind of the ones I mentioned and showed on the map before. Out of about 522,000 students attending schools in these districts, we found almost 57,000 students had a homelessness experience based on the YRBS. That's an estimated prevalence of about almost 14%. And looking at the official education counts for these districts in that school year, it was 40,000. So about 16,000 students weren't identified in these districts, even though they experienced homelessness. So, what does it mean? How many high schoolers did education systems miss? Well, about 2 in 3, right? Homeless high schoolers were not identified in the 28 states, and something like 1 in 3 were not identified by school districts, comparing those YRBS-based estimates to the official counts at the Department of Education. A lot of students may not be getting the supports that they are entitled to on account of their homelessness. We also found that students reporting homelessness were disproportionately students of color, were disproportionately male, and disproportionately identified as lesbian, gay, bisexual, or transgender on other items in the YRBS. So in the 24 states, Black, African American, Native American, Hawaiian, Alaskan, indigenous groups, or Latinx, Hispanic students were more likely to report experiences of homelessness when compared to white students in the YRBS from the 24 states. And now these are odds ratios, of course. The vertical line at 1 on these graphs represents an equal likelihood. Asian and Asian American students were less likely to report experiences of homelessness compared to white students, and students reporting multiple races were about equally likely to report homelessness as white students. So we see these disparities for these groups. And then if we look at the same question, but for the 12 districts, it wiggles a little bit, but is mostly the same or similar story. The only real difference here is that Asian and Asian American students were not more or less likely to report homelessness compared to white students across the 12 districts. In the 24 states, we found that students who reported homelessness were more likely to identify as either lesbian, gay, bisexual, or transgender, consistent with the literature. But again, we're quantifying the disparity here. And students were also more likely to report their sex as male if they reported homelessness. And the findings, the interpretation was similar in the 12 districts. Homeless students had increased odds of identifying as LGBT or reporting their sex as male. And we also found students reporting homelessness were more likely to experience victimization than their stably housed peers. The YRBS asks multiple questions about different forms of sexual victimization. Largely, it varies from state to state, but it's largely 3 questions that asks if the student had been forced into sexual behavior that they did not want to be a part of. Similarly, they'd asked multiple questions about physical victimization. This is, have you been physically injured? Have you been physically victimized? And then the third victimization area is bullying victimization. Have you been the victim of bullying? And we found that students reporting homelessness were more likely to experience each of these 3 categories of victimization. So again, we'll start with the states. Sexual victimization was more likely among the students experiencing homelessness. Physical victimization, bullying victimization. We'll talk more about poly-victimization in just a moment, but this is a group with varied adverse experiences, not just homelessness on average here. Okay. And here is the same variables, the same odd ratios for the 12 states. It's the same story. Homelessness is co-occurring with each of these different kinds of victimization in the lives of high schoolers. But it's not just that homelessness shows a clear link with each kind of victimization. We also see that there is an accumulation of different kinds of victimization experiences that goes along with homelessness. All right, so let's start by looking at which high schoolers had no victimization experiences at all, no sexual, physical, or bullying victimization. And in the 24 states, if we look at all public high schoolers, about 2/3 of them had no victimization experiences at all. But for the students experiencing homelessness, only 37% of high schoolers in the 24 states had no victimization at all. So this means that the rest of these students are reporting homelessness and at least one kind of victimization. Now, if we break it down, 2 kinds of victimization. For all public high schoolers, that's even more rare. Only 9% experienced any of those 2 kinds of victimization. Whereas among students reporting homelessness, 25% of those report 2 forms of victimization. And then just to round it out, if we look at 3 forms of victimization, all 3, sexual victimization, physical, and having been bullied, we find that the subset of students reporting homelessness report all three kinds of victimization at 3 times the rate as all public high schoolers. Okay? Now, the YRBS also is cross-sectional, but it also asks about different areas of functioning. So, we took into account the demographic characteristics and the disparities I just showed you, and we used that to predict adjusted risk for these indicators of poor functioning. And we found that homelessness was linked to poor functioning across the domains we were able to look at because the YRBS asked about them. Okay. So, homeless students, compared to those who did not report homelessness, had a much higher likelihood of severe suicidality, substance use, alcohol abuse, risky sexual behavior, and poor grades. And I want to just point out that the YRBS has lots of questions, but we just use the indicators of, really, truly poor functioning. So nothing that could be within the realm of typical or normative adolescent risk-taking or experiences with respect to these outcomes. So when we're talking about severe suicidality, we're talking about a student who had a plan, or who attempted suicide, or who was injured from an attempt of suicide. And that's what we're calling severe suicidality. And you'll see throughout all of these definitions, these are things that quite intentionally would normally warrant a clinical intervention if they were recognized as going on. For substance use, we're not talking about experimenting with marijuana or something like that. We're talking about hard drug use, cocaine, methamphetamine, heroin, things like that. Using these drugs one or more times. Any injection of a drug would trigger the presence of a substance use problem in these data. Alcohol abuse was defined as excessive drinking, binge drinking, or driving while drunk. Risky sexual behavior referred to a high number of partners, literally 4 or more in the past year, and or the use of no pregnancy prevention or condom use to prevent a disease or pregnancy. And then poor grades we defined as mostly D's or F's in school based on the self-report of the teens. Now, across the states and districts, we find an increased odds of all of these negative outcomes if a student reported homelessness. And here we have our forest plot here. Districts are in red, states are in blue, and then the lines give you a sense of the confidence interval here. And we see, again, all of these, none of these are intersecting with the equal odds line. So that's a lot. I'm going to try to just quickly summarize the key findings once more, and then with whatever time left, I'll leave some time at the end for question and answer. But I will at least touch on some of the recommendations that we make in the practice and policy realm based on these findings. To summarize, many more high school students experience homelessness than are identified by the schools. Among the states, about 500,000 high schoolers said they experienced homelessness based on the data in the past 30 days, based on the data on the YRBSS. That's about 9% of all high school students, and about 1/3 more than the state education agencies identified as homeless all year in the 18-19 school year. Oops, should have showed that. There it is. Now, considering the 12 school districts, because again, we analyzed them separately, about 14% of all high school students reported homelessness on the YRBS. Almost 57,000 high schoolers and over 16,000 more than identified by these school districts all year. There is clear inequity in who experiences student homelessness. Students of color and Hispanic Latinx students, students who identify as LGBT, and male students are each more likely to experience homelessness based on the YRBS data. Now, the YRBS data doesn't tell us why, but other research offers clues. Contributions are made by systemic disadvantage, racism, anti-LGBT bias, and for some students, acting out behaviors that are more likely among males than females that might contribute to family conflict, family rejection, running away, things of that nature. Though, those things I just said, by no means is it an exclusive list, a comprehensive list. I'd be remiss if I didn't point out that affordable housing and the lack thereof is a prime contributor to family homelessness and to some degree to adolescent homelessness too. Teens who experienced homelessness reported high rates of physical victimization, high rates of sexual victimization, and high rates of having been bullied. Some students may have run away from homes marked by maltreatment and victimization. Others may have entered into dangerous contexts when they became homeless and encountered and been victimized at that point. Some students may have experienced victimization both before and after entering into the homelessness. These data can't say for any student here what direction the causal arrows point. Did the victimization contribute to the homelessness? Did the homelessness contribute to the victimization? We need some more good longitudinal studies to get at that. The YRBS as a cross-sectional study can't really speak to that. But other research suggests, both causal arrows are valid in other research. Homelessness is a context of risk for problems, including the ones we looked at or were able to look at in the YRBS. Alcohol abuse, hard drug use, severe suicidality, risky sexual behavior, getting bad grades in school. Each of these things individually was lower for the group of students who experienced, all of these problems were higher likelihood for the students who experienced homelessness, indicating risk. But it's also important to point out that about 15% of students who experienced homelessness showed none of these problems. Those are resilient students. I can't tell you what's different about them because the YRBS doesn't seem to have measured it. As a risk surveillance system, it's very sparse on resources, protective factors, things that we think predict resilience when adversity occurs. We need more research to get at that, and of course that's going on, just not here today. So what do we need to do? First, an elephant in the room, at least for education agencies, is to fund and improve the education systems. That's true broadly of other systems too, when it comes to identifying and serving students who experience homelessness. Too many are being unrecognized and unserved. That's what the YRBS is adding to this conversation, along with what are some of the services that they will likely need. Well, let's go in the classroom and talk about the education system and some specifics there. And I'm going to say what I'm about to show you is about 2018-19, and some of it's updated for 2021, but it's apart from the American Rescue Plan. The American Rescue Plan has a big chunk of money targeting student homelessness. That is not recurring. It's actually unheard of. It's unprecedented for this work. But outside of that, the ongoing annual budget federally for the program called the Education for Homeless Children and Youth Program in the U.S. Department of Education, it's really low. It's really underfunded. And the federal allocation in 2021 was $106.5 million. And let's put this in perspective. Let's just divide that by the official count in 2018-19 from the education system, which we know already is a gross undercount. And so if we divide it out, it comes to about $76 per identified homeless student. I don't know what you think you can do with $76, but education systems, there's not terribly much you can do with $76. So what ends up happening is the education system then has to draw funds from other things like Title I and stuff like that if they want to serve these students, and many don't. And that's not good. But I just told you that the YRBS is estimating that the true prevalence is a lot higher than those official counts, right? Roughly 200% higher than the official school counts. So that $106.5 million gets stretched even more when we understand that many more homeless students are out there. So if we put in the YRBSS estimate, we land on something like $26 per homeless student, and a comprehensive response to student homelessness won't get very far on $26 per student. Now, if the legislature hears the message and we get more than $26, what would we do? The bad news here is that there are currently no evidence-based systems interventions to identify and respond to student homelessness in schools. These need to be developed, they need to be rigorously tested, they need to be disseminated, and they need to be funded like other education programs and interventions. This is going to take an investment in education research aimed specifically at this issue. And while I would love to say specifically at my grant applications, which is true, let's get it, even if it's not mine, let's get it done. Let's figure out a good evidence base of something that will work, that we can disseminate to systems. Now, we're not starting at square one, right? There are promising practices like professional development that can help teachers and staff in schools spot homelessness. But we have to, do more than that. We have to make sure that there are the supports available that these kids will need once they were spotted and identified, and that teachers and staff know how to help students and families across these supports. Okay. Now, I think I'll do this slide, and then I'll maybe call it, because I want to leave time for questions and answers. But as a developmental psychopathologist, we can't ignore development. If we want teens to be successful adults, we have to first support them to be successful teens. And this is a call for promoting resilience. Resilience happens most frequently because of students' strengths and teens' positive relationships, like relationships with parents, teachers, coaches, and mentors. Teens need opportunities through recreation programs, through after-school programs, and through residential stability to allow these relationships to happen and continue. If you're homeless and you have to move far away, it's going to be disruptive. You're going to lose touch with key relationships. You're not going to be able to go to these programs anymore if they're geographically distant or for other reasons. These programs and these relationships are the contexts in which teens develop and use their strengths, which promote resilience. This is how strengths come to be and then can be used for resilience. Now, all adolescents try on new behaviors and new identities to see if they fit. But trauma, disadvantage, stress, they complicate the behaviors that teens try on. Now, we have to understand and we have to ensure that disciplinary practices maintain appropriate limits, but they don't further exclude and marginalize students that might be turning a short-term adolescent development teen behavior into a long-term adult challenge. Okay? And we need to support families and parents through conflict resolution and counseling when a teen might be trying on one of these behaviors that a parent doesn't necessarily approve of. Sometimes these supports need to help manage the teen behavior. Other times, the supports might need to help navigate identities that don't ally with the family's values. And these things are vitally important based on some of the findings we had today, especially around LGBT youth and their risk for homelessness, as well as youth who may be causing conflict with their family for trying on behaviors with alcohol, substances, and other behaviors that the family doesn't approve of. We need to do a better job joining with youth to understand what today's findings mean as well. Sorry, I've neglected advancing my slide. Okay. And so I will say that we have a protocol just getting off the ground to present these findings to youth and have them tell us what they mean. What are the supports that are needed? What do these relationships mean? What do these counts of homelessness mean? And so I hope to have those findings for you, probably next year, because that one's just getting going. But the voices of youth are so important to include. Okay. And finally, let's prevent teen homelessness. Let's support families and teens. Let's create safe spaces for teens when homelessness occurs to prevent further victimization, for example, and to help support adolescent development and promote resilience. And of course, there are the big capital I issues that as a society we need to end racism, poverty, and other forces of systemic oppression. Okay, so that's about 45 minutes, I think, so I'll end there, and I'm happy to take any questions and kick off a discussion.
Well, thank you so much, JJ, for this incredible presentation. Very sobering, but also, with some hope on if we all work together to change, to improve, or to decrease racism and decrease poverty. Any questions on for Dr. Cutuli? Well, while people think about questions, I have a couple. So, were you able with the survey to determine what was the proportion of teens were really by themselves or homeless because of family, eviction, family poverty, and homelessness in the family?
Yeah, so we had two questions, and we lumped. So the two questions are like, okay, where do you usually sleep at night? And that was very definitional, right? And so that question was formulated based literally on the federal requirements, the federal definition for the education system of what counts as experiencing homelessness. And so that one's very straightforward, and it maps right on to the federal definition for education systems of, okay, that's homeless, that's homeless, that's homeless. The second question tries to get at kind of a looser but still important category of homelessness that is also in the federal definition, but just not so crisply defined, of unaccompanied homelessness. And that second question asks, did you sleep away from your parents, which is important. If you left the house because you were upset, it wouldn't be a yes on that question. You had to sleep away for at least one night from your parents because you were kicked out, abandoned, or you ran away. And it's that second question which we think is getting at this unaccompanied homelessness just by themselves. And not every state and district that we included in these analyses asked both questions because they had to proactively put them on to their YRBS. And frankly, not every state did that. Some asked one question, some asked the other question, some asked both questions. But we did some follow-up analyses on the places that asked both questions. And what we found there was that the unaccompanied question indexes a similar level of risk for all outcomes than the other question. So this is consistent with kind of this idea of homelessness as being kind of a blanket term, but a heterogeneous population, right? As you're asking about sort of the homeless with family versus the homeless on your own. And so, because of that, we have some reassurance that we can use either question to get at different parts of this population. You kind of have to ask both to get the whole population. And that's a message that I'm sending to the world and to the CDC. As you do this again, ask both questions everywhere. that probably won't happen in 2021 because spots on the form are like gold. And so there's just not enough room to ask all the questions we would like, but I'm hoping to keep working on them with these findings.
But
Now,
what? I'm sorry. Go ahead.
no, please go ahead.
What is the proportion? I mean, is it more frequent for the teenagers to be homeless by themselves or with a family?
Yeah, there's unfortunately there's no one easy answer to that because it does vary widely from place to place. What I can say with certainty across places is that the places that asked both questions, it didn't overlap very much. It was about, if we were to look across places, it's about 2.5% or 3%. I don't have it off the top of my head, but it's something like that, where it's maybe 3-4% to maybe 3% split. I forget which direction it is. And then there's only like a percent, 1 or 2% that answered yes to both. And that kind of further underscores this point that you want to ask about both questions because you're not getting a lot of overlap in the two questions. And that, frankly, I'm looking forward to asking teens with lived experience of homelessness what these questions mean. Like, why would someone answer yes to one and not the other? And we'll be asking the teens that, once we get our IRB squared away and the community partner starts connecting us to the teens. But there are sizable percentages of both kinds of homelessness based on the YRBS that's out there. And, again, if you take away anything from this long-winded response, it's that they're both homeless, they're both at risk, they both need help. There might be specific challenges to engaging the two parts of the population, but it's worth meeting those challenges.
I think, Scott, do you have a question?
I do, but there was a question before mine in the comments. I don't know if you want to start there.
And I'm sorry, I should say I can't see the comments.
Okay, so let me read the comment. I'm not quite sure who mentioned it. Really interesting. Are some states identifying homeless students better than others, and what are they doing differently? Also, did you do any breakdown of states and what state policies have been influencing services to youth homelessness? And do they have a better count of homeless students because they actually have programs to help them?
Yes, absolutely. Okay, I'll try to edit a little bit because I'm long-winded. But absolutely. So first of all, I want to say that everything I presented here and more, like lots more, is available in a report that we published earlier this year. I don't have the link handy, but if you want to shoot me an email, email's up there. Shoot me an email. I'd be happy to send it around. Send the link around. You can also find it on my Twitter feed and kind of everywhere else where I can speak to the world. And we go geography by geography, state by state, district by district that we have access to for these data. And we report out everything we know, in the realm of the findings and topics I've talked about today. So you can look state by state if you have ones you're particularly interested in. Without going into all the intricacies of how school districts, how states, how communities identify students experiencing homelessness and serve them, I'll make a blanket statement which might get me in trouble, but I think it's true. And it's, maybe I should put it a different way. There seems to be a big difference between school districts and states that own this problem, that give a damn about this, and ones who don't. And there are some that are in between, but it's pretty dichotomous. And you can look at this in various ways. There are ways to set aside Title I fundings for school districts specific for homelessness. And there are some states that do that, and there are some states that don't. They report out, the Federal Department of Education reports out for state by state and district by district the number of students served experiencing homelessness. the modal number of students identified by school districts in the United States is 0. They just don't do it. They don't reach out. They don't have a way to do it. And that's one layer of problem. And so the states and the districts that aren't doing it at all, they should do it some or make an effort. And then for the ones who do it, there's all kinds of gradation about how sophisticated and comprehensive their efforts are. And I won't get into those details now in the interest of time. But a lot of it boils down to whether they care or not, because there is technical assistance. There are professional development communities for this stuff. But there's no one way to do it, and there's no rigorously developed approach that's evidence based. And so a lot of people who care go out and make the best out of it. And we can do better as a society, I think.
Thank you. Scott?
Hey, thanks, JJ, for the presentation. Very interesting. And you mentioned this other report, which I'd love to take a look at. But I wonder if you presented some demographic characteristics that were associated with the higher odds of homelessness. Did you look at them from sort of an intersectional standpoint, looking at more than one of these at a time? And then the flip side of that question is, among the LGBTQ group, that's also a very heterogeneous group. Did you have the opportunity to look at people who may identify in different ways?
Yeah. Thank you for this question. I think it's really important from a phenomenology point of view, but also from a methodological point of view. And so the short answer is not really, as far as breaking down the intersectionality. Some of that is ongoing.
Okay.
And so we did it for Philadelphia. And so what I presented today is very, very much typical for these kinds of analyses. They're variable focused. They're looking at one variable related to another variable, adjusted to a set of other variables, very variable focused. But if you look at this from more of a person-centered approach, that's where you start to get the intersectionality, particularly if you let it be more of a data-driven process. And we have underway, it's not done yet, but for the big sample, we have a latent class analysis looking to get at groups of students. And we did it as kind of a sketch for Philadelphia. So I'll talk about Philadelphia as an example. But I don't know about kind of the whole deal, the whole big sample. But if you look at Philadelphia, the data are going to give you the categories that are there, right? They're going to give you the probabilities of co-occurrence, and from that you get latent classes, right? And some of it's really like interpretable from a intersectionality approach with respect to homelessness, and others, a lot of it is driven by race. And race is so important that you don't really, that's not really surprising. But among the other classes that occur, something that was a problem in Philadelphia is that it's a very high risk place. It's the poorest large city in the United States. And so homelessness wasn't predicting outcomes very well. But if you allow like an intersectionality with homelessness and race and victimization, you get latent classes that have higher rates of we had to dichotomize it, so it's white, not white, Hispanic, not Hispanic, but higher rates of non-white and Hispanic groups clustering with other risks and relating to higher clusters of poor outcomes. And as you go down kind of the resilience ladder towards higher levels of risk, more and more homelessness is represented in those groups. So what was happening in our variable focused approach in Philadelphia is it was occluding the intersectionality. I didn't mention LBGT, but they contribute as well. And it was occluding the intersectionality, and homelessness went as a cluster with those other risks and with the indicators of disadvantage that we had from the YRBS, which are largely, non-white status and things like that, which I kind of hate to use, but it's kind of what we have. Race is important. There's so much other stuff the YRBS doesn't ask about to contextualize that, so I want to be careful about that. Anyway, those configurations that you lose in a variable-focused approach are very, very important. The other thing I got to mention, though, is when you do that, there are configurations with intersectionality that pop out the resilience stories as well, or pop out the non-homeless classes as well. LGBT students. There's a class that's defined by LGBT status and is doing pretty well on almost all indicators. So it also makes the risk story more complex. It makes the resilience story more complex too. So that paper is under review, but intersectionality is important. It does kind of help clarify. There's some things that I don't really know what to make of because it's a data-driven process. Now, on the LGBT front, there weren't enough responses and indicators on the transgender question in particular to break that out from there were separate questions, LGBT question, and there was a transgender question. Mm-hmm. The endorsement rate for the transgender question by itself got a little dicey when we were crossing it with homelessness. And so methodologically, it kind of got wonky. And so we decided not to do much with that in particular. But for other questions that don't require the intersection with homelessness, the YRBS is a fantastic resource for looking at risks associated with transgender status to identify need. Again, it doesn't have strengths on it. I wish it did, but from population level, there are some things that can be done there. And just homelessness wasn't one we can do a deep dive on.
Gotcha. Thank you.
Well, thank you very much. Unfortunately, it's already a few minutes past 1, so we have to stop. I'm sure I had a few other questions, so maybe we'll talk offline at some point.
Without a doubt.
Thank you so much again for this really very interesting presentation, and thank you everyone for attending.
Thank you so much. It was an honor.
Bye.